My philosophy of care is solidarity, and I do that through a process of accompaniment. My name is Bonnie Larson. Right now, my practice is entirely working with First Nations patients. The role I play in the lives of my patients really varies from just a stopgap Band-Aid to being a long-term presence in someone's life. I've had the experience of sometimes being the only regular presence in an individual's life, and that means much more than just writing a prescription. It is my responsibility to think about all of the factors that impact that person's health and well-being, including things we don't traditionally think of as being in the domain of a doctor. My role is to be there for my patients and to help them, not to judge them, not to contextualize their experiences for them. If you can't sit in front of somebody who is telling you that they had an experience with racism, for example, and say, "I believe you," then you're not going to get anywhere with them. For the population that I serve, the root causes of illness and suffering are a combination of the traditional social determinants of health, things like poverty, lack of education, in addition to trauma. We all need to have the mentality that we should be getting our patients to a standard of care in whatever way we can. Sometimes those barriers are not huge, but sometimes they are. To be a healer is to be an advocate. Part of learning medicine for me was about who gets the voice in our society, and if I'm going to speak on behalf of those who are oppressed, as a doctor, I can amplify those voices.